afternoon, everyone. Premier is on a call with the First Ministers this afternoon, so we have the Deputy Premier Minister Akeeagok here. He's going to start us off with an update, then Dr. Patterson will have some brief remarks. We have the President of Nunavut Arctic College here, if there are questions specific for him, and we'll just go into questions right after Dr. P. Thanks.
Unusakut, sibulakti manaka lautik katimahata ma sibulakti katiminut. Tana tuglea sibulakti David Akeeagok kalimalangayok amaluluta Patterson kalimatalekok. Tabani kata mayangayok nga sila to sabi kapek hute sa habewumapa.
Koyan namin, malakoyan namin, unusako pasin Nunavut katika ila ako sa watak tugoro tana sibulakti but sabi kata udlumi katimakata mata kuninga sibulakti katingin manayo. Udlumi mo tikisugo tana November 19 Nunavut mo ngitoksule tamakko niriun nikun ubaroni sakya la tatuko pitakang itoksule mana. Udlumi Inuit kawik saktaw simavo 530 amalo 253 sulit kawik saktaw kawik saktaw na simadlutin 277 anigo di simadlutut kawik saktaw yun netun. Udlumi takwa Nunavut Arctic College sila to sarvikut ilinyarvik harvingin amalo idlokotingin matumanera mata takununga ilinyartinun kisene okea mapilaridlune takuadlo ilagiyayui idlunginitui ilangini idlungini innarunnarsuti ilinyartiin sila tu sarvikut pileriinginta takko amalo iliseyingin takko iliniarte kotinginit tusa tora tiniartu takko nunga kanu pileria sakana matike takko pilerianginin ipassa tana usikartauti qangatassu tawangat aku kitulea sopto tamaunga sangut tawro mai kharunnun tana sila pitjutigidluneu takwa tambunga mitare khalila mata takwa angerot nunartoale mame angot yo khataktu tigut tamaunga migi akha lila mata takwa pingaso yoktut iqanayaqti tabani lapon tanaro khangataso inutuinarni usilaungin ningano tamaunga migunnarilaqtuit ammalo aniyunnaqsilluta qangatasuumin takwa tana pilere qatigiyawtiarsuni luttaangoyo Patterson takwa qangatasuuqti pilere tak qangatasuuqti teikunga tuyomivimmoqti tawrililaupput taakkuninga atoqsuti kisuunartayinko matoarni atoksutin ammalo idlosamuortitaatuin idlosingannoortitaatuin narsuti tabbani anitaili titaullutit qangattalaunganningani taanna qangatassu 5:30 miulla qangattaqqaavu taakkuallu qangatassorti tikiti malortit ammalu tabbani iqalunni inuqotit inni uqallaqati qalaunatin ubbalunni qanissaqtu qalaunatin unnu yok 6 mappan takwa Nova Scotia mi iqauman kharneamata taana qaasau yakkut iqaumane takwa amisui inuartaorortui iqauma niarattigut tabbunga pinasuarasi nunguano tikilertillugu ilagiyaugumagusi ati qaasau yakkut ubaluni talavisakkut tautunniarpasi takwa nangiqatigiyumattiarartigut Nova Scotia min ammalo Canada miutalima takwa 22 inuartauyukururartuinu tabanila pensuarasi nungurartillugu uqqusivalliallunilusila ammalo siqinnilapalliatuinnarsuni kisiani uqarpugut suli aneqqarsimattiarissi tamaanilu qanigiiqattautitteelimalussi piliqatigittiarlusi taannaaksorunnartuqaayimajavun ammalu tusannaqqui tusangoq tassarileq Tasiwara kisen tusa makatigit tiara kakatatas ng mga akso ta na piyara kadataatigon. Temen na ito'y nauyara kapugoy lang ang malo kating ngalota kisen na avis si malota temen na. Taan na udlutama piliriyara katabon ang malo temen na itidlugo. Takwa nunali piliriyara katatangin kanu ilok tangin lo takuninga piliritiarluta anak kaksimatyar na po si tana anak kaksimatyar na mo inusang ni pakititiyaman ko yan naming. Good afternoon. As it was mentioned, I'm filling in for Premier Iqaluit today as he's on a call with the First Ministers right now. There are no confirmed or probable cases of COVID-19 in Nunavut. Today, the number of people under investigation to date is 530. 253 people are currently under investigation, and 277 people are no longer under investigation. Today, we are announcing that all of Nunavut Arctic College campuses and facilities are now closed to students until the fall. Students with families can remain in Nunavut Arctic College's family residence. The Nunavut Arctic College program heads and instructors will be in touch with their students directly about if and how their program will continue. Yesterday, a freighter aircraft flying to Greenland had to divert to Iqaluit because of weather. The technical diversion is permitted under the international agreements, and 6 crew members were considered essential workers. If the plane had been carrying passengers, they would not have been permitted to disembark the aircraft. Working closely with Dr. Patterson, crew members were transported to local hotels in personal protective equipment and were isolated in their rooms while they carried out their mandatory periods for their rest to be able to fly again. The aircraft departed Iqaluit at 5:30 this morning. There was no interaction between crew members and the members of the general public while they were in Iqaluit. Tonight, at 6 p.m. Eastern Daylight Time, is Nova Scotia Remembers, the online vigil in remembrance of the victims of the tragedy in the province last weekend. If you are interested, I encourage you to participate online or on TV and stand with Nova Scotians and all Canadians to honor the 22 victims. Heading into another weekend with warmer weathers and sunnier days, we once again ask you to stay home and practice social physical distance. I know this is hard, and I know this sounds repetitive, and it is repetitive, but it is crucial. We all need to do this, and we all need to stay apart together. It is not fair for those doing it all day, every day, but if some of you aren't, each of us has the community responsibility and the collective duty to stay home as it stay home and save lives. Thank you for allowing me to provide this update.
Thank you, everyone. I'd like to announce that today the government of Nunavut is rolling out a free online self-assessment tool for COVID-19. This resource is user-friendly, available in all 4 languages, and can be accessed through the Government of Nunavut webpage, gov.nu.ca/health/information COVID-19 novel coronavirus. The purpose of this self-assessment tool is to provide Nunavummiut with real-time information and recommendations based on self-reported symptoms or recent travel history. This tool will help Nunavut determine whether they should self-isolate and when they should contact a healthcare service provider for additional follow-up or testing. This tool is meant to supplement the existing resources that are already available, and it is not a replacement for social distancing and good hygiene, such as hand washing or such as washing hands regularly. Mass gatherings are still banned, and everyone is still asked and required to follow these rules. Nunavut who don't have access to online resources but believe that they are displaying COVID-19 symptoms such as fever, cough, or difficulty breathing are encouraged to call the COVID hotline at 1-888-975-8601. You can also ask someone with internet access to complete the self-assessment on your behalf by sharing travel history and symptoms with them, or contact your local health center directly. Thank you.
Ulume nalo na sigo mayong Nunavut kavamakong sakirtich na lang ngata kikangit tumik kakisa yak kunam mini kawi sako tumik Nunavut nak 19 kangi kala mangapin tana ayok na kani malitaw siya ako nak to inaulo ni sita manik ilisa kayaw si mayunik o kausumnik kakisa yak kulo Nunavut kavamakong ito kaya kivingan ni piyaw kunak suni gov.nu.ca health information COVID-19 novel coronavirus. Dan napidjutingan namin ni kawi sa kutiyo Nunavut mute tukisiga ako tikakon na hulugi atuli ko yidjutin ilo namin ni kawi sa kon na hulugi ti mimini kamalo aw lakatak si mamanga man na mako namugala. Dan ikayo tiyo na ako Nunavut mute namin ni anitayli tigaham na mga amik ubalo kang agkuan na binukaw ikaw tigaham na mga mikaw isaktaw kaya kakuni. Tanay kayo ti kakaning agumanaw yu ikayo ti uyut atuin na uyut ikayo ti tuin na king of beauty ganilo ino katigit unga sige katakayaham ningin ni kamalo salo magaswa katakayaham na mo king of beauty yung itok. So lag katiwasay na katanglugi suli ami sulutilo ino katigi katakayahang itot suli Sulilo kikuli mamali hattaqaya hartut malitta khuya yuni Nunavut mute atu inahangitu kharisaw yakku kiaqivikuru tinik kisiani tamakkuni ngahanu iguti khaqso iguti Nunavut nartuni 19 mik surlu uternarutik khussu hattarutik ipinarutiluni ukhalagun narmiyut Nunavut namu tukisigar bimu khalaut akikhangitu ngasittumik 1-888-975-8601. Ukakatakaron na miyute ko na minik kawisam ng mot kawisako jaw gumalutit asinot kawisaw yakuro naktumik amalo nalo na bigilugi nakinga namaw lakatak si makatalaw mangapit ubalo kano igutakakto yang mangapit ta kunung alo ni kawya yalutit nunat sinni anapit sinno.
Ken Driscoll, APTN National News. Dr. Patterson, the Deputy Premier mentioned the weather's getting nicer. It's a good weekend to be outside. What are the restrictions, if any, for people traveling from community to community?
Ken Driscoll, APTN kunik Dr. Patterson, tana sivulakti tudling au hakkaw masilat siyang ulak tilugo takwa kanu maligahak taha mga ta manaw yutang ngako.
Our advice and request is that people limit non-essential travel between communities because of the difficulty in contact tracing and the lag time in diagnosis right now. But if people want to go out on the land, to spend some time out on the land and camp with their household, we fully support that.
Takwa isulip takbiyo si matitaw gayali nunalin ni ukukat takwa singin nunalin ayong nakayang akikun ni tako yumini mga ta amalo kaw yesa ko taking over si makatak tilugit kisa nilum yung katigi no si magumatoy ako titaman na ikayo sutsak tavo arlak si makatakong namningin.
And the COVID-19 investigations that you've been undertaking, I'm wondering, Can you break it down as to a little more as to where those are happening? Has there been one in every community? How do they break down regionally? I'm wondering if you could put any finer point on those numbers.
Tahan na nuvat juat nak 19 mo kawya sa kutaw katak tu ta ko kano iling ang mga tagok tok si mayo. Nalo na yung nakawigi na may kawya sa kutaw katak kan nunalin ni hamalo tok si mavyo unit kawya sa kutaw nakpango katak.
We're not able to discuss too much about community level data. There have been investigations done in every community, but we're not going to get into the level at each community.
Ita ko sa kilo ako nang itakano na nale ni usimang mga atake sa ano hakunak tong ano nalilimani kawya sa kutaw yung kaksimayo.
Rajni Sharma, Nunavut News. Dr. Patterson, can you just clarify for us, when it comes to health staff, what kind of measures should they be taking? Should they be wearing gloves when they're interacting with patients?
Sharma, Nunavut pivalya yung kunik luta Patterson tukisinak tiga akong nakita ko na bimikana yakti kisunato katara kasur lagga katta agga simakatara hakan.
Yes, well, it depends on the circumstances. If there's somebody who's got symptoms of a viral respiratory tract infection, whether it's COVID or influenza, then the recommendations as part of the personal protective equipment or PPE includes gloves.
Kasi ato ni kanoy tuning surlo kamagiyak hakata hanima yuyak tuning surlo haniman na tuin na may ubalo nuvatjuan na kanoy guta hakata ma maligiyali amalo ato kayali namin isapu may gutin ikta ko ilagay yaw lutiagka.
Okay, so if I was to go to the hospital or the health center and I'm not showing any, symptoms of COVID-19, the physician or the healthcare staff who's interacting with me, they don't necessarily have to wear gloves.
So lo ana bila ko ma ubalo no nalid ni ana bimo to hakka kanoy guta hakto yang ko mata ko ni ano wan na unik ta na luta ubalo ana siokti tema ato ga yang ila.
It depends on the other circumstances or nature of your complaint, because there are more infections than just COVID-19 going on. And so some people may choose to wear gloves, or it may even be recommended depending upon those other circumstances. Just because of the nature of the pressers in the day, I was focused on the COVID-19.
Ila kanoy tu ningi malilugi ato ni takatakayak to solo nuvat juang na asingin ni siya maktukakon namin mat ako ato ko yaw kayo katak to agkani.
I just have a question for Minister Hicks. I'm just curious, right now, besides diagnostics, which Dr. Patterson talked about a few conferences ago, what is the most pressing concern for the government right now when it comes to COVID-19?
Minister Hicks mapik kuti ta nakawi gumayok ta ko ako si yu kawi sa kuti kang mo luta Patterson ako si yang imano yu ta kisu nakpa kisu isumalo ta nakpa ngano wadyo na bitsano tamani no nagum.
I think it's quite apparent the societal practices, people not adhering to the social distancing, still continuing to gather, whether it be for recreational purposes or in-house gatherings or even worse. I can't stress enough how important it is to continue to maintain the recommendations from Dr. Patterson to continue to keep COVID-19 out of Nunavut.
Ino katigi na mo pilirid yu so lumalit siya katangitut kipingwe ya katigitut ubalo pula ka katigitut ta natso tigi kanira larga kakatigo malitaw ga kamning iluta Patterson atule kusimayang itaman na nuvadyo nak 19 Nunavut mo isikunago.
Emma Tranter, Akeeagok News. This might be a question for Minister Hicks. I'm wondering the money that the federal government announced to support students during COVID-19, do we have any idea how much Nunavut will receive of that money, how and when it will be distributed? On Wednesday, I believe the Premier didn't have those details. Just looking for an update.
Emma Tranton on at Sarpe Vallejo Lericonik, Minister Hicks, Taco Government Nalo na sila nga tailid natin o ikayo tinik kaya mabino na bo hatsini pinamangata pingat sang me sibulak dito kasi ilapis si mayungiman.
And unfortunately, I can't give you any more details than the Premier was able to provide on Wednesday. We are continuing to work with our federal partners on exactly how that money will flow and for to what purposes it will be intended to be spent on.
Iluligin niya kaya mangitong at sibulak dito pingat sang me kiugun na yung masuli kiugun na itong government o hakot pilira katigin naktakalwabot tamak kuno nga.
This might be for Dr. Patterson, but we've heard from some communities that dentists aren't operating on the same schedule they normally would. So are dentists considered essential workers, and when will dentists be working on their normal schedule again?
Kanapok kuti wala yung Dr. Patterson mo to sa magamailangan ni nunalin ni kigutiliriji dalo na tao si mabapim mariyunin ni kanayangin ni ambalo hanga ko pigakan ni runalaka tako kigutiliriji nunalin no katarningi.
Thanks. Dental emergencies are considered essential, so abscesses, infections, things like that need to be dealt with immediately. That would be considered essential. Regular maintenance checkups, that's been across the country, that's been delayed for now.
Tako kiguti lerina mo to avernak to hakata solo kikuseri patalonit tana pimariu nerakta yo pik sirau tau ga harninga kisane asingi solo salo masak tau ne ko balo ila jau tu nang ne an ne itu ni kat kana talimami pimariu ngin nerakta yo.
Beth Brown, CBC. My questions are for the president of the Nunavut Arctic College.
Beth Brown, CBC ko na apik ko tinga yok hangano sila to sabi ko.
Thank you for joining us here on with our presser. Can you explain what the status is for the Arctic College and for students? I understand some programs are still ongoing online. What students are studying and who's finished?
Yan nami kayo nakabit kano iling alikata ko ilin na tino kano iling ko tayo yo surlo mat na yo hakisaw yak ko ilang ilin na katakan.
Ako din namita ko utak siyak si mamata ilin na ti ilise jilo ikana yak tilo ilang inalo lang ito ilin na ko tayo yo pijer na tuit ilang it pijer yakat si juit ilang it nukang kain am na tuit okay sa mo nun. Firstly, thanks to all the student, staff, and faculty for all of their patience during this time. There's going to be a mixture of some programs we know that are going to be complete, some that are very close to being completed, and there's some that will have to be canceled or further suspended until the fall. And we'll be communicating those directly with students and faculty, and as well as posting information on websites and social media.
But you don't have any examples right now of specific programs?
Ato na ilin na ako tayo yo surlo kisuban.
As an example, tanaw utakaw tigito nakalago pero sila revimi inar ni ilise yakaw at kanayak yakaw suta then nalalong ni chao tigiyo matmakay na kaya hamna mo kaya sa mo in is magilugit. So just as an example, we have our cultural school up in Clyde River, we have a number of elder faculty. So with their primary safety in mind, we've had to close that facility down and suspend the programs until the fall.
We've learned that funding for students is not, we don't know yet in Nunavut if we're going to have access to any of that. But what is it that the Arctic College needs right now, or what is it that students will need support with in Nunavut?
Tako kina yailin natin na tawla ko galawa nunavumyo no pijagon nam na mga tanalo na to galawa kisa nila kiso ni sila to sakbit ko pigya kan laki pamalna.
Ako din namita ko how is ako letlita nadle pijagon na mga ata nadle kasi sikan na mga ata man amis fi katuja katigi pilot to make government kot iloni. Tako ilin niya tinut kina da kako tiuji utu tigilawit amal sila to sa min nalle kadu siniapan tako katuja katigi gaswak menyebut nalle ilinniartinut uhaujortaugiarnaq mangaataqaniulanganeranartangitni taakko nalulangittu saqqipullianiarmuju qaujavalliatilta ilangi ullumi kiulinnangi kaluarattigu nani qaujigaiqutta taakko nalunertautiarterniarmijui. So we are working with a number of departments and agencies and partners with the college, particularly within the government of Nunavut. We have a number of departments that provide things like student support and funding. So we will be working with those departments to try and provide ongoing support to students as we try and determine which programs will continue, which might not continue, and that'll kind of determine what supports to put in place, as well as determining what everyone is going to need, not just the college.
Ken Driscoll, APTN National News. New Brunswick and Saskatchewan have rolled out gradual plans to try and return back to normal operations. I'm wondering, is that something we can anticipate happening here in Nunavut, and if so, when?
Ken Driscoll, APTN Kunnik, New Brunswick, New Saskatchewan, New Lu, Parnau to Hapalangata, Utakpalalarna Mutama, Inu Sirihata, Hangalineri Nakatama, and Nunavumi.
Yeah, we're still finalizing the details on our plans, and it also rests on those criteria we talked about before: no COVID in territory, we have testing in territory, and that the areas that Nunavummiut typically travel to and from for medical care and other reasons, that they're on the downslope of their curve.
Naluna yaks ila iluling itako parnau ti suli kamagivalle yavut surlu tako maliktau ila atuinau ge hakneang atatako pigarun naksigutti go surlu nuvatjuar naktohangillu ni Nunavummi qawisarutit saqtahalerlu ni Nunavummi ammalu Nunavummi aularbigigayuttangi halluna ni katapalle ale qataqatsiuningi nuvatjuar naqtaahattartut.
And apologies for the confusing language I chose. By downslope, I meant that their numbers are starting to fall, meaning that their situation is significantly improving.
I got that.
Okay.
And I'm also wondering, the airplane that landed our surprise visitors yesterday, was this something that your office had anticipated could happen as a part of your emergency planning, or is this something you guys had to figure out on the fly?
Actually, it's something that we anticipated even with COVID-19 as early as January. Our first meetings and our first concern of risk of introduction was related to flights diverting to Iqaluit, because it happens once every month or two that an international flight diverts. So mid to late January, we started meeting with all of our federal, territorial, and municipal partners involved in an international diversion and created a scheme and format to deal with these kind of situations.
January me katimakatilluta tamakko uluga nakutaugunnartu tikigutaugunnartu nuvajuanartumik Hauyamanang hangatayuni neriunangittuni katausia makkuatilluni takkitama tikittoqasungum manunarjuamingaartunik taakko January hitiani nunguanilunni taima nunarjuami hangatayuni tikittoharneqqat parnautaharpanliagiirsimayuyugu.
Emma Tranter, Nunavut News. Dr. Patterson, I'm looking for more details about the self-assessment tool you announced today. I'm wondering why now? Why did that come out now? And I know that it's not an alternative for, of course, actually getting tested, but what is the accuracy of the self-assessment tool?
Emma Tranter, Nunavut Kunnik, taakko hoso qawya nammine qawisarutiigunnartut summa lemana saqirtautaleqqat ammalu kingupiutiugani qawisarutau ila qawisarutillaqinnut qanutaana pijjutahanga saqirtautaqa.
Thanks. It's been under development by federal government and others in the South for a while now. The wait was to ensure that it was working, that it was validated and reasonably reliable, and then getting it all of it interpreted into all 4 languages so that it was accessible for all Nunavummiut.
Tana kitsuktaw sa malakta ko ni galak gavamatok kuno tambalo kalo na ni miunut utakige kalaw kata nalo na taw sa mahulugo tan kano ingit sa kalo mga kamalo suligod na kalo mga kamalo tukiliok taw ga hamne nga sita mano kausok no takige kalaw megatigo.
And then just the accuracy of it as well. Can you tell me more about that?
Amalo kano tamma ko na mga balo tamma simagayang ni mga nalo na yon nakyo.
It's reliable when it says that you don't need to get tested, but it's not a replacement for saying that, like when it says you should get tested, you should get tested. The majority of those people will turn out not to have COVID, but the idea is to capture everyone who has symptoms or other thing like travel history that's concerning for COVID, and then they're referred or advised to get tested.
Tana malitaw siya kung naktugalo kasi ani king of beauty yung ito kaw yasaktaw gahang ng mot so lukaw yasaktaw gahak nakaktaw yung kakaw yasaktaw gahang laki gayak to tako no ba dyan nakto hang ito yung nakakalawak tilugit so lo kano igot kakto ya ko ting no ba dyan nakto no ngayon ni ko balo aw lakat tas magud ni no ba dyan nakto kakto meniyo yun ni.
My last question about that. I imagine that generates then quite a bit of data for you with people taking the self-assessment tool. Are you doing anything with that data? Is it being used to inform anything you're deciding in the future? What does that look like?
Tako no ataw gayak to hakisaw yak ko namin ni hakisa ko ti ko nakto no tako no apisiu kamalo kisu no ato ti gigon na kaya at siu sibunis sa tin.
To be honest, I don't know. That program has been set up in the South, and the data is being, if it's being captured, is being captured there within Canada, but not within Nunavut. So I don't know if we'll be able to separate out the answers between Nunavummiut versus, say, an Ontarian or anybody elsewhere across the country.
Sulilo nga taan na kaw yung mangitsak ta kakiud juti nga ta magkuad no ataw yung hakisaw yak ko kanata mi atok taw na mga ata kisane no na pumila atok taw jang ito amalo sulo nalo nakto imiko nga titaw na mga ata no Nunavut amalo Ontario ta na nalo giya.
I'll try to find out and let you know on Monday.
Kaw yung kaswalak to tama tumi nga nagkadya mi kaw yung kalak tati.
Beth Brown, CBC. My question is for Minister Akeeagok.
Beth Brown, Minister, kaya ako mapirigo mayo.
I understand that by next week you'll have to make a decision as to whether or not you're going to keep paying money for the airlines. My question is about airlines. To continue those payments that were put in place for 4 weeks. My question is, when you were deciding on how much money the airlines would get, and they've seen the bulk of payments from the government of Nunavut and a large amount of money from the federal government, did the airline give you any sort of financial confidential statements, or did they show you or share anything with you to say that they needed that money right now, understanding that all airlines are struggling, but do you feel confident, and were you shown data on why they needed that support?
Kinasa ko siya lahat tumita ko ano kalala palay matay la ila isumalayo ko tiya kala nga kanga tayo liri akilik suktaw indang na mga ta sitaman ni pinaso ako sa miunar na raktaw yung mat kano le sumalayo ko ti kayo visi kano tigino na buga pa makunga akilik na mga ta malaga pa matukakut kinaw yan ni titiras mayo ni ta ko kanga tayo liri tunisi jiwa to tsirak siti kayo magalawak to nga kanga tayo liri at suru takakto na ila at suru te hanga ta kano leita ko kano tigi tunin ang mga piginalo na tayo ba
Iko yun naming Manila ta ko pili katigi katigi makong matita ko kanga ta sorti ta ko nga kano kina ni ato ka matike man na mutta ko kanga ta jutigi hatta tangi kimi ko sinar sutigun amul te ko uwatin tunisi badlelo ta ko kangon akto ko tita muta te neti lugo ta ko ang ikatigitia sa mga tabuna kang unang ningin ni kanulo atong natatin tamak ko nga Akeeagok nitin tusama tiao magata amalutako at kinawe kadaktuang mata Nunavut mitano atuktaw ni atun tem netidlu kawis at tiao magatigo tabuna piliri yavun amalu piliri hatigitiya asuktugo tako nga kagatasoktunin. The short answer is yes, we are working very closely with the two airlines in terms of they're providing their financial information on in terms of how to operate within these parameters, and we're working very closely with the two airlines in terms of getting the financial information, and it goes both ways because as government, our public money, we're going to spend a lot of money on airlines, so we need to know what is being spent. And with that balance, I'm very happy. I'm happy that between the airline and the government, that interaction is taking place, but it's taking place in a very confidential setting because we have to balance this from a business and a government aspect. So taking those two into considerations, I'm confident, and once we have the relevant information, then we'll make those decisions.
Okay, it's good to hear you that you're confident in how that decision making is taking place, because it is a lot of public money, and we have been talking about our airlines as being essential, but it's also a large corporation that has a monopoly in the territory. So, as you're going through these discussions, is there any talk of having an arrangement to have that money paid back to the territory in better times? Should the airline be able to do so?
Tana tusa ko minaktuga lo akta ko kinaw ya kasalo matalo kava makullo kikulimano lo kinaw ya ya luti ta ko alo namme riya nga yo alo lo ne ino to jillo tino na vumi awlat sinang mga khanga ta yo le rinirmik o khakto khaksma bata ko utakti tawla mga ta
ko yun nami manaw yo tanela khanga ta so khanne ako tito ari gatigon taunan kadonane akotituman ila akotikot namunga ko nakatamata tamani li Nunavut temne temne tidlugo tan kano akitu ningalo kawye madlutigo akili rehnatigo kano akili kano ne amatke oboluni akikin saune amatke tan ilulingi o kawsere yunangi te kamana ta ko solimana akiga sukatigo amalo manamo kano kia Akeeagok tugutas mamisano. As I stated before, unlike our other provinces or territory, Nunavut communities, the only road system is our airline, and that airline is essential for us to go back and forth within the territory. So that is the critical way that we're looking at it from that aspect, and how we're going to make that decision and where it's going, and those discussions are still ongoing, and I wouldn't want to disclose it here at this point because there is a lot of discussions, and there's a variety of options that we're looking at, and we don't have the firm details. Once we made a decision, then we'll be able to provide a better picture on whether we're paying back or they're paying back. But it's our objective right now is to keep our road system open.
yeah
Listen to me. Oh.
My question is for Dr. Patterson.
Luta Patterson aperigo mayo.
We've heard from you that we're not going to see any of these restrictions lighten up in the near future until we get diagnostics. We've also heard from the Premier. I was listening to his interview this morning, and he said that perhaps we could see testing in the territory by the middle of May. That's about 3 weeks from now. Is that sort of a time frame that people can start looking towards for when they might see a change in how they can live their day-to-day life?
tusasimaga matakwa isulitta beauty tautita ti malitta kartita ti pigia jangi mata ila khasodia valle jangi mata manakku piloartu mi khawi saudita khartinago sibulertilo khaqama ulla persortautilugu takwa khawi sautit sai piyunnarsila ngata me khitiani takwa sulipingasu mata penasarusit tema khangakku asijir palle ala qatamanna inu siriyavut aula tauninga.
It's really hard to put a hard date on this because it's a constantly evolving picture. It could be earlier, it could be later than that, because it also depends on things that none of us can predict, like whether or not COVID happens to arrive in between now and then.
Tana nalunat siartu ullulertau gaswal nga tamanna sijir pallangin nangan khilamiuner saula mga ubalukinguni agula mga ubaluni sulu nuvadjuanartartu haitane qatamani nunavumme kisutuinna sijir hattanga tatamanna nalunartu kiugana.
And so my advice to the minister and the premier will be that we start to ease those restrictions when it's safe. And that's more important to me than predicting a firm date, and that we do it gradually because so many jurisdictions have eased restrictions very fast and then noticed a significant spike in cases.
Bakhautiga takka sibulerti amara minister khatigi takko khasujauga narsi patakisiani attanarunner siritsiarukku Pimariunersa matamakko attanartumi tailititsigaarne qammalu sukkaittumik tamakko khasujauvalle alaartuit atautsikko alungillutik asinginni avittorsimaviujune asajjersiluartilluga amisongukat lahattarsimammatanu vajjuanartaarsimayu.